Unfortunately, a person's worst day is a normal day for our crews. And when that emergency strikes, and who knows what it is, they have to be ready for it.
GMR is on healthcare's front lines. The first call in an emergency involving high acuity, life-threatening, and time-sensitive situations.
No one wakes up planning an emergency. Much of what we do is preparing to respond to those unplanned events rapidly, effectively, and with the right tools.
We respond at a moment's notice. As soon as the call comes in, and we deploy the resources that we believe are necessary for that individual that's in need.
Our crews are ready 24/7. And it's not just actually transporting patients, it's actually taking care of people where they're at. We recognize that 30% of all calls do not need to go to an emergency room. So if it's a child at 2 in the morning that's having a medical event or a fever and you don't know what to do, you call 911. And then those that are in the lower acuity will then get moved over to our nurse navigation system.
Over 60% of the U.S. population resides in a county served by GMR. Our extensive scale and logistical expertise ensures we can respond in a moment's notice. We respond to 11% of all 911 and 33% of air ambulance calls in the United States.
There are communities in this country, especially in the rural settings, where we are the healthcare system. We're the only access to care for these individuals.
There is no average day in EMS. In a single day, we'll see over 200 critically injured trauma patients. We'll see over 130 patients who have an acute stroke. We see about 90 cardiac arrests in a day.
We operate in 50 states. We respond to a situation almost every 90 seconds. That's just about 6 million patient encounters a year. You do that with close to 25,000 clinicians, with 500 air apparatus, 8,000 ground apparatus, delivering healthcare at a moment's notice anywhere. And I often remind people those ground and air assets are mobile ICUs. They're miniature emergency rooms that happen to be either on wheels or on wings or on rotors getting to you.
In the event of a large-scale disaster, GMR works with states, the federal government, and health systems.
We're in essence the easy button for a disaster. We deploy within 24 hours. So what's GMR's why? And the why is truly the patient. It's what this team lives every day in and day out.
You know, there's an art and a science to everything we do. The science is the drugs, the tools, the approaches, the readings, the EKGs. The art is the humanity. It's the connection. We're there to support, to walk them through, and to use that humanity to say, we got you.